Hi everyone, I'm Dr. Kaufman, and welcome to this week's GI Oncology update for the Ruesch Center for the Cure of GI Cancers. This week we have several heavy hitters from high impact journals with core themes like precision oncology, biomarker driven therapies, and the rise of prognostic calculators to personalized patient care. First up, we have the much anticipated atomic trial data that we first heard about last year at the annual ASCO meeting. And we now get to see all the details of this phase 3 randomized control trial that evaluated adding immunotherapy with chemotherapy in stage 3 colon cancer patients who have MMR deficiency or MSI high disease. So over 700 patients were randomized to either 6 months of FOLFOX or 6 months of FOLFOX with 12 months of atezolizumab. And the results were impressive. An increase in 10% of disease-free survival at 3 years was seen with the addition of immunotherapy in this biomarker-selected population. That's impressive. Slightly higher toxicity, but nonetheless, we're excited to see immunotherapy move up earlier in this disease in a population we think would be most benefited from it. It complicates matters a little bit in the sense that some of us prefer shorter interval chemotherapy based on the IDEA collaboration data. But nonetheless, this is moving the field forward for this population, and it begs the question, would IO alone be enough? So more to come. Next, I want to highlight pivotal work by one of my former colleagues, Dr. Wong-Kee Park at Memorial Sloan Kettering Cancer Center, who published a first-in-human trial in the New England Journal of Medicine looking at setidegrasib in a heavily pretreated population of advanced solid tumors. So KRAS G12D is a common variant in pancreatic cancer, which is a disease that I treat. And we have had a hard time targeting this protein, this molecular mutation, in decades past. But recently, we've been seeing an explosion of clinical trials in this space, many of which are inhibitors. This drug works a bit differently. It's a protein degrader. And I included the schematic from the preclinical data of a pancreatic cell line looking at the difference between a protein degrader, this particular drug, and a KRAS inhibitor. And what you can see in the schematic on the slide is the difference in expression of KRAS G12D with each drug type. With the protein degrader, which binds to the KRAS G12D and degrades the protein, inhibiting all of its function, we don't see it recur, re-express over the course of 7 days. However, with an inhibitor, you see a diminishment of expression of KRAS G12D, but you start to see it repopulate over time. So this study was intended for safety, which it demonstrated, and very excitingly, it also showed early hints of impressive efficacy in a heavily pretreated population of pancreatic patients, mostly second and third line, more third line than second. And we normally don't see these numbers in this type of disease, unfortunately. So this is very exciting, and we look forward to seeing where this drug goes. And finally, I want to show you a new tool for localized pancreatic cancer. The Transatlantic Pancreatic Surgery Consortium created a prognostic calculator for patients with localized pancreas cancer after neoadjuvant FOLFIRINOX. So the group looked over retrospectively at over 2,000 patients across the world and identified 8 patient, tumor, and treatment response factors that independently predicted survival. Only a few of these factors were measurable at baseline, whereas most of them were identified after restaging, usually around 3 months of FOLFIRINOX for most patients. And then, based on those factors, they were able to stratify them and create a risk model of their survival risk. And you can input your own patient data in this online calculator that's free and easy to use to create a personalized predicted survival curve to help inform and personalize conversations with your patients. So that's it for this week. As we see from these studies, the future of GI oncology is increasingly precision and biomarker driven. Very exciting trials this week and more to come. Thanks for watching. We'll see you next week.